Right Care empowers us as commissioners and providers.
Right Care is part of what we do every day.
If we use Right Care in the way it is intended to be used, the outcome for the patient is always going to be better.
My name's Dr. Tim Burke. I'm a GP and clinical chair of Northern, Eastern and Western Devon Clinical Commissioning Group. We've started to use Right Care over the last year. We're really embedding this now in how we approach service improvement and all of our planning for the future of service change.
New Devon CCG is the largest CCG in the country. We cover a population of 900,000 people, and that gives us a budget of £1.1 billion.
In this year we had to save 37 million to hit a 40 million pound deficit. So that meant we had to work quite hard, quite fast. So we had to look around for a very good methodology.
Right Care is a methodology by which CCGs are compared with similar CCGs across the country to work out where there's room for improvement.
NHS Right Care has been running nationally for some time now. What we're doing in Northern, Eastern and Western Devon is using it at a system level for our whole system quality improvement programme. Right Care this year has looked at about 70% of the services that we deliver as a commissioning group. So we've looked across 17 different care categories, and about 70% of the money that we spend has been analysed by the Right Care project teams.
For each subject area, so for example, maternity and neonates or cardiovascular, it will give us the information about where we're outliers, where we're underperforming or in some cases overperforming. When we get that information, it's presented to us in the form of a deep dive.
My name's Rob Watley. I'm an analytics manager for South, Central and West CSU. My involvement is to produce the information that feeds the packs that will be presented to our customers. In order for deep dives to be successful, make sure you've covered the whole of the patient pathway, and then at the end of the process, make sure you've got some actions that the CCG can take that have come out as a result of the deep dive.
So we want to look at what's relevant for our potential project areas, and we then go on to do our optimal service design workshops.
And it's been really pleasing to see in the room hospital-based consultants, GP colleagues, physios, OTs, nursing staff, all contributing their knowledge of the system and their insights into what can be better for patients and for the whole system in terms of our clinical and cost effectiveness.
It is about making sure that patient has the absolute right care and is delivered from the best place for that patient, and it maximises the opportunities to improve the health and well-being of that individual.
We need to be able to bring down what we're hearing from Right Care and look at it in the context of what's happening in our local area. In some areas it may show us that we just need to do something in a different way, such as coding. In other areas we can find that actually we might need to redesign a pathway.
I think as a hospital we're committed to continue to work with the CCG around the Right Care programme. The most important thing that commissioners can do is to make sure that providers and so on understand what the drivers and the aims are of the Right Care programme.
It's absolutely vital that you have all the right people in the room, and then subsequent to the actual day I think it's very important also that the providers get feedback as to actually what the outcome was of the meeting and where we're going forwards.
The Right Care programme to the end of this financial year is going to be split into two parts. There's going to be a rapid delivery part where we're going to take the benefits that we can deliver immediately and put those in place. So those programmes include musculoskeletal, cancer and our cardiac programmes. And the second part is going to be a focus on planning and benefits delivery. So we anticipate seeing all of the Right Care programmes delivering their benefits from the 1st of April onwards.
NHS Right Care has turned into a real team effort in Devon, and we're really grateful to our provider colleagues, all of their clinicians, the commissioning support unit staff and our own staff who've put a huge amount of energy and time into going on the journey of Right Care with us. We wouldn't have been able to do it just on our own as a CCG.
Right Care is an extremely important methodology that I think as a system is the way forward, because we can make sure that as providers and as commissioners we are understanding the whole pathway, where the opportunities are and how it can be redesigned in a better way.
It has been hard. People have had to adapt. They've had to work together, so we've broken some of the silos that normally exist within organisations.
Anything that challenges variation, allows us to benchmark consistently is a good thing.
NHS Right Care has the ability to ensure that we produce better outcomes for patients.
It's about the right person having the right intervention in the right place at the right time, and that's what I would call right care.